Hi, everyone. I'm Angela Cates. I'm a pharmacist and functional medicine practitioner. And I work with parents of children with ADHD, anxiety, and depression, and just kind of meeting them where they're at, either helping them with their medications or exploring root causes that could be underlying some of the illness. But part of what I like to do is also bring in guest experts as resources because there's so many aspects of treatment to address as you well know as part of this. So I'm excited today to introduce Stefanie Rodabaugh. Stefanie is an occupational therapist, and she is the owner of the private practice Exhale Therapy and Wellness located in Marion, Indiana. Her mission is to serve women and children by providing holistic occupational therapy that focuses on all aspects of daily life to help clients reach their goals. So I was really excited to bring Stefanie on because I feel like this is an area people may not initially think of as far as ADHD and anxiety. So happy to have her on and kind of share some of her expertise with us.
Yeah, thank you for having me.
Yes. All right. So first off, I kind of explained a little bit about what you do. And I know that you mentioned you work with both women and children. So I guess let's start out. What types of things do you do to help children with ADHD?
Well, overall, occupational therapy as a whole, no matter the population we work with, our goal is to help people be able to do the things in life that they want to do and need to do. So that's really, it's pretty broad if you think about it. But specifically for kiddos with ADHD, a lot of the deficits that we might see could include like social skills, organization, attention span, self-esteem, time management, problem solving, even like sleep hygiene, ability to do their daily tasks, like participate in school, homework, chores, even morning routine, such as getting ready for school. Just where any of those might be a little bit challenging, we can try to help eliminate any barriers to success.
Okay, so great. Really just, helping them. I love that. Helping them with their daily activities, helping them reach the goals that they have to try to reach in whatever setting it is that they're struggling with. So.
Yeah, it's very holistic. And so I love that about occupational therapy. Like you were talking about your, when you reach out to clients, you are holistic and meet them where they're at. And I feel like OT is very much the same way, that we kind of meet you where you're at and figure out how to roadmap you to where you want to be, and to kind of break down what the barriers might be to reach your goals.
Yeah. Okay. Now, I know a lot of children with ADHD can have sensory issues as well. Is that something that you help with?
Absolutely. Okay. I feel like sensory processing and treating that is kind of a secret sauce to occupational therapy. I feel like it's one thing that OTs are very well trained in overall and have great, every therapist is different, but I feel like that's one of our specialties, is to understand and to assess a client's sensory processing and how that affects them functionally, if that makes sense.
Mm-hmm.
Because how one child perceives the world and their sensory understanding of the world can be different from the next. So to be able to kind of pick that apart and to understand what each child needs sensory wise, that makes sense. Kind of like, for example, if they're having trouble focusing in school, can be a lot of sensory components to that, whether it's noises that are distracting or bright lights, or maybe they need to chew on their pencil or something like that to be able to pay attention. So it's kind of figuring out what works for that kid and what works for the family and the environments that they're in.
So, I mean, it sounds like from what you're saying, sometimes it can be too much sensory input, like the noise, the lights, but sometimes they actually need some sensory stimulation, like, if they're chewing on things or picking on things. I mean, sometimes they actually need stimulation. So
Right.
that's something you would help assess and come up with a plan for.
Absolutely. Yeah.
Yeah. Okay. Interesting. Now, how about anxiety? Like, what are there tools or things you can do to help children with anxiety?
Yeah. Again, I think that can overlap a lot with sensory processing too, as well as ADHD, which I'm sure you probably see that as well. Um, can work on coping strategies that are healthy and functional for that kiddo and that family. And that can vary with age of the child. Um, such as learning how to relax and what that feels like in their body, and to also know the signs of anxiety, like, okay, when I get this feeling in my belly, I'm feeling anxious, so I need to try to do this. It can be tricky to understand our bodies, and a learning curve for a lot of kiddos. So that's something we can help them to understand and to better know how to help themselves.
Mhm. Yeah, I think you're right, especially, with children. Yeah, just understanding, like, what is this feeling? Like, why does my tummy hurt? Or, why am I upset? Why am I having a meltdown? Like, what feeling is behind that? Kind of understanding that, I feel like is probably a big part of it. And you're right, there's so much overlap with anxiety, ADHD, the sensory processing. But I think, having them understand what the feeling is, just to help with some of that emotional regulation, because the first piece is really understanding the feeling before you can even address kind of getting that under control or how that feels in your body.
Right. And to help their caregivers, I feel like understand that as well. I think that is a huge part of what I do, is help parents to be able to learn their child's what can set them off into a meltdown, whether it's a certain type of sensory stimulation, or if, just to kind of pick apart those daily activities. And that way the parent can best prepare and best modify their environment and routine to help the child be successful.
Mhm. Yeah, I think that's a great point, because a lot of times, in the past, maybe we've been taught or thought that behaviors, most children are not having behaviors because they want to be bad or act out, but there's some kind of dysregulation, like you said, whether that's a sensory issue or whatever, something has triggered them. So as parents, for us to be able to learn and understand and help guide our children, I feel like that's a big key, important thing.
It is a big key, and it's hard because that's a shift in parenting styles, even from maybe how we were parented.
Yes.
So it can be a big challenge.
Yes. All right. So maybe for people who haven't been to OT before, like, what would a session typically look like for a child? I mean, would the parents be there? What would they be doing? How does that work?
I guess I can only speak for myself. I have a private practice. Parents are typically in the room with me. I have had some kiddos where it can be distracting to have the parents in the room, but for the most part, the parents are there and involved, because there's a lot of parent education in what I do, because I want you to be able to carry over what we're doing in the clinic at home. But overall, like, the first session's a lot of questions, some formal assessments to try to get a good grip on what's going on and what this kiddo needs, and what the parent is seeing as far as being what deficits they might be having, what they're great at, what we need to work on, their relationships with their teachers and family. Like, it's really kind of delving into every part of their life. So there's lots of questions the first time. So, but then after that, it's just, looks like playing, honestly, especially with the little ones. I've often thought parents probably think I'm just goofing off, because it really just looks like we're playing, but everything has a purpose, and you can kind of adapt fun things to make them therapeutic. For the younger ones. The older ones, I think it can be a little bit more formal and a little bit more kind of tabletop activities, talking about routines and schedules and coping strategies and things like that.
Okay. Yeah, I love that. It's, you get them to play, and that's how they can open up and talk about emotions. And like you said, integrating your therapy into play so they don't even really realize it's there.
Right. Right. Get a little bit more buy-in that way.
Is there like an average number of sessions that usually you have patients attend, or does it just depend on like what you're working on and their goals?
It's very different based on each client's needs and their diagnosis. I would say on average, maybe for a younger child would have a little bit more sessions, maybe 10 to 15-ish. But it varies with each kiddo. Older kids maybe less if they're pretty high functioning and have a good understanding. And it also depends, as I said, as far as carryover at home, that can help help them reach their goals faster too.
Yeah, that's great. Like if they're practicing at home and implementing, they may be getting there a little bit quicker, if that makes sense.
Yeah.
Do you need a referral from a doctor to work with an occupational therapist?
In the state of Indiana, you do. I can legally see a kiddo for, I think it's up to like 40 days without a doctor's referral, but it just depends on what state you're in as far as what the regulations are. I typically try to get a referral. With insurance, you usually need one for sure. And it's just kind of good to keep the doctor in the loop, especially with kiddos.
Yeah. Yeah, and I'm sure especially if that helps with insurance coverage, that would be a real benefit.
Yeah.
Yeah. Do you ever recommend like assistive devices or things like that to help children with ADHD?
Yeah, and I was thinking about that, and a lot of times it's kind of informal things, maybe like a calendar or a planner, or with younger kids, like a visual schedule, kind of like mapping out what they're supposed to do in the morning or something like that. It could even be little things like to help them focus at school, whether it's a type of fidget or a type of water bottle that might be a little bit more stimulating to them and help them focus more. Things like that. Nothing too formal, but
yeah. But just like little things that kind of, yeah, or if they have sensory, like maybe different types of pencils, or what about like the chairs or like some of the seats they sit on? I've seen some of those. Is that anything you would ever be involved with?
Most school systems have an occupational therapist
available,
and they would probably be the one that would recommend the seating system within the school. But yeah, I could definitely give suggestions, and that is a good means to help with attention.
Yeah, that's a great point to make. Yeah, if the schools have an occupational therapist, they're probably helping with some of the classroom accommodations.
Yeah, they can be a great resource.
So I know you're located in Marion, Indiana. So for anybody around here, you would be available to see clients. But what about people maybe who are outside of this area? Is there a good way for people to find an occupational therapist?
Honestly, I don't know of a formal like directory. Your pediatrician would be a good resource, or even just the internet, Googling pediatric OT, you can usually find something.
Okay. And that was kind of my next question. Do you need any special training to work with children? I mean, could any occupational therapist help, or do they need to look for somebody who, specifically works with children or pediatrics?
I would think you don't need necessarily special training. I think just having the occupational therapy degree and license is sufficient. However, I think each therapist has their own niche, I suppose, as to what they treat and what they specialize in. And maybe they've taken extra trainings along the way. to work with pediatrics. So I would look for somebody that advertises themselves as pediatrics.
Mhm. Okay. All right. Is there anything else that you want to add about what you do, or anything else you think people should know?
I can't think of anything. I do appreciate this opportunity to speak on ADHD. I feel like you said, it often is overlooked. I mean, we talk about kiddos with other neurodivergent diagnoses such as autism, which can, a lot of the times OT will get a referral for kiddos with autism, but ADHD, there's also a lot that we can do to help that. And like you said, it's often overlooked. So I do think it can be a great resource. So appreciate the opportunity to speak on that.
Well, I'm glad to have you, and I'm always, wanting to educate people about different team members that they can, pull in and help address different aspects. So yeah, thanks for sharing with us today.
Yeah, thank you so much for having me. I really appreciate it.